And my biggest concern was safety. I think that's everybody's first concern, because when you hear about an office-based center, you think it's like a clean room or a procedure room. And, it didn't take me very long to realize that this isn't what this is. This is operating rooms that are in your office. They're just classified differently. What I learned that what we could do with an office-based surgery center was build something to the same or better standards for eyes that ASCs require, and that we can get accredited for that. And so we can build an accredited center in our office that's just as safe or safer than an ASC. And so that helped me really feel comfortable with that. And there was a study out of the Kaiser group, Mark Packer and his group came out with this in 2016, actually, 2015 data, but really nice study. And basically the summary is that they looked at in-office versus comparable ASC data, and they found that endophthalmitis was actually less in their, and this is a big study, 21,000 patients, 21,501 eyes. They had an endophthalmitis rate of 0%, and retinal detachment was actually better than ASC data. Vitreous loss was better than ASC data, and perioperative AE was negligible, 0 in both. And what's nice about coming into the office-based surgery now, which I didn't have this data in 2015 when I was looking at this, but now we do. And if you look at iOR's internal data from their office-based surgery experience, they have 5,000 IOL surgeries now. The data compares actually a little bit better than what the Kaiser study did. And so we can even take, so Kaiser was comparing, ASC to office-based, and now we're comparing our current version of office-based to what was being done 3 or 4 years ago, and we're finding that it's improved even more since then. So that data has been helpful in kind of establishing the safety in a scientific way. But what I've found just anecdotally in our experience is our own internal rates. I feel more comfortable operating in our center than I do at ASC. I had a fellow with me the past year and a half, and his comment was he vastly preferred doing surgery in our center compared to the ASC, and that was somebody that was just coming in very raw. And so all that kind of leads to the same conclusion, which was the safety has been something that we feel really good about.